But let's stay on COVID but move away from the airport. President Akufo-Addo has described as unacceptable the alarming drop in the number of people who wear face coverings and masks. During his 16th address to the nation on measures to deal with the coronavirus, he warned that there are laws to deal with anybody caught breaching the COVID-19 safety protocols.
I've been reliably informed that in some regions of our country where there are no active cases, some residents are abandoning altogether the protocols, such as the wearing of masks put in place to defeat the virus. Indeed, the high compliance rate with mask wearing of persons surveyed by the Ghana Health Service in some selected areas of Accra, to which I referred optimistically in my last address, has, according to a new survey by the same service, fallen alarmingly. This is not acceptable, as the enhanced hygiene, mask wearing, and social distancing protocols must now be central features of our lives, and they must continue to remain so for some time to come until we see to the elimination of the virus from our country. Let me remind those amongst us who want to continue to disregard these protocols that severe sanctions exist in our laws for such persons who will want to endanger the rest of the population through their actions and negligence. The law enforcement agencies will, where necessary, apply these measures without fear or favor, ill will or malice, and without recourse to a person's ethnicity, gender, or religion.
So why are people refusing to wear masks despite evidence of its efficacy in stopping the spread of the virus? Well, I've been joined by Dr. Emmanuel Johnson Owusu-Ansah. He's a lecturer at the Department of Statistics and Actuarial Science, KNUST. He led an investigation into this phenomenon. Thank you, Doc, for joining the show this morning. So tell us what you found in your research. Is it just a blatant disregard for the directive to wear face coverings or masks, or people just don't understand why they have to?
Good morning, Benes, and good morning to your channel viewers. I think what the president actually said yesterday was actually true, and a lot of people are just abandoning the protocols that they put in place to help us, all of us, to get actually the COVID under control. Now, it is quite very worrying that if you go to our marketplace and other places, people are disregarding this blatantly without any reason. But what we have also found out actually indicates that some people actually do have, when it comes to the education on the use of face masks, is quite low.
Okay.
Because there has been some kind of virtually low rate of advertisement in the use of face masks. Some people also do not actually understand why we use face masks. Some people think that we use face masks because the president said we should use face masks. For the purpose for which we would like to achieve by using the face mask, it is not known to them. Now, we did some kind of observational studies in our catchment area here, and then there are some things that we found out which was quite very alarming. Now, the face mask use is quite only compliance in official buildings, corporate buildings, and corporate environment. So whenever you're going to official buildings, corporate buildings, and corporate environment, you see people actually trying to comply with the use of face masks. But as soon as they get out of that place, they disregard it again. So it comes as a result of people feeling that they might be forced to wear face masks or something of that sort, which is not the case. So in this case, I will plead with the authorities to actually help in increasing the education on the use of face masks. Now, if you remember, in July, the KNUST COVID-19 modeling team actually predicted that if you have 75% of our population wearing face masks, we could reduce our case to 80% in 45 days. Now, that was in July. Looking at the updates that we have, we can only achieve this if about 80% of the population keeps on using face masks. And if 80% keeps on using face masks, then we can continuously see our cases going down. For the fact that our cases going down does not mean that we are out of the woods. We are still not out of the woods. There could be a second phase, and this is what the authorities, the Ghana Health Services, are trying to prevent. Now, when it comes to the use of face mask itself, public health experts have spent months emphasizing on the masks that are of most effective to help us. So in this pandemic, that is the only tool, with addition of some of the social distancing measures, to help us whilst we are waiting for pharmaceutical intervention. In the U.S., some researchers actually tested some 14 commonly available masks, which actually including the fitted N95 masks, usually reserved for healthcare workers. They tested this 10 times, and the most effective mask was the fitted N95, and the 3-layer surgical mask, cotton mask, which many people do have access of, which the Ghana Food and Drugs Authority have approved, also perform well. But the spongy one, the neck fleeces that is used by runners, and then the folded bandanas and the knitted masks did not perform well. So, in as much as we are also telling people to use face masks, it is very imperative that they should use the correct approved face mask. We should not do anything that gives us a false sense of hope that we are protecting ourselves whilst we are not protecting ourselves. Because using the correct approved one by the FDA is the most essential one to help us in the fighting against this pandemic.
Is very dynamic, and the world over there's still studies ongoing, new findings every day. You led a team to do this research, which you've shared with us. Are you still on the ground? Are you still monitoring? Should we expect anything from your team soon?
Yes, the team is still on the ground. Actually, the focus of the team right now is to evaluate the various mitigation measures as and when government strategy changes. So that is what we've been doing over a couple of days now. Now, we hit the ground for us to do observational studies because we know that people are disregarding about the use of face masks and social distancing. Even though they've given some kind of reasons, you can see most of the reason is the denial. People just do not believe that there is COVID. That's something very dangerous that is actually can come back to haunt us in the near future. So we should continuously, it seems the topics of today, the political issues are taking the center stage more of the COVID. So we should try as much as possible to balance this for people to know that it still exists. For the fact that we are seeing decrement or decreasing numbers in the COVID does not mean that we are out of the woods. Also, some people also are not wearing masks because they feel it's uncomfortable, but that is not a reason because we need to protect one another.
Did that come up in your findings? Was that reason people gave for not wearing the mask, that it was uncomfortable?
Yes, when we ask people, they said it's uncomfortable. They are not able to breathe as they used to. But that is not a reason not to wear face masks. It is not a reason. For the fact that you do not feel comfortable does not mean that the virus does not exist. So all what we need to do is to educate people. We would like you to wear it whenever you go to public places. Whenever you leave your house, you must wear this. And then we need some form of enforcement, even though the sense of responsibility is much more on us. But we need some sense of enforcement also for people to know that we need to do this in order to help all of us.
I really appreciate your time here this morning. Dr. Emmanuel Johnson is a lecturer with the Department of Statistics and Actuarial Science at KNUST, and he led a team to research COVID in Ghana and the use of masks and how it will help deal with the virus here in the country. You're watching News Desk. Coming up shortly in business. Securities and Exchange Commission expected to commence payment of locked up funds to investors from tomorrow.
Whom claims were filed by affected clients.
We've got details shortly. Do stay.